Today we'll shine a light on an organisation making a real difference in the local community. We're talking about the Community Doctor, a community-focused medical centre located in Ringwood, East Melbourne. The centre is built around patient-centred care with doctors and allied health professionals working together to support the health and wellbeing of individuals and families. From preventative healthcare to multidisciplinary support services, the Community Doctor aims to create an inclusive and welcoming environment where patients feel heard, respected and supported. Joining us today is the Centre Manager, Arris Apos, and one of the Centre's osteopaths, Leyton Campbell. Welcome to Monday Matters. I'm Ian Bunston. Well, welcome Arris and Leyton. Great to have a chat with you guys this morning.
Thank you. Good to be here.
Great to be on. Thank you.
Arris, let's start with you. The Community Doctor places a strong emphasis on patient-centred care and listening to patients. From your perspective as the Centre Manager, how does this approach just benefit the broader Ringwood community?
Yeah, it's a really great question, Ian. Thank you. So, yeah, a lot of benefits naturally. So, obviously, Ringwood is a genuinely diverse community. We see patients from all walks of life. So patient-centered care means that we can meet people where they are and not where we expect them to be. So in practice, this looks like, giving patients the time to be heard in their appointments, not rushing them onto the next item or the next, care item on their list, but really understanding, I guess, what's going on for them. It means our GPs are building long-term relationships with their patients, and that's continuity matters enormously. So, when a GP knows your history, your family, your stresses, the care they provide is fundamentally better. So for the broader community, the flow-on effect would usually mean fewer unnecessary hospital visits, better management of certain chronic conditions that may arise or that currently exist, and people who actually trust their GP tend to come back when something's wrong because we have broken down so many barriers that may currently exist with entering care. So this philosophy isn't just GP focused. It runs through every single touch point from the moment the patient calls or walks through the front door. Our reception team know our regulars by name, like yourself, Ian. And we remember their circumstances. We ask how things are with their life or how their last appointment went. And it's not an accident. It's something we actively cultivate into the way we run the clinic. Our nurses are often the ones that patients open up to the most. There's something about a clinical relationship between the nurse and the patient that breaks down those barriers. And we tend to lean into that. I've got a clear philosophy about the way that I run the clinic and how I want patients to feel. I like them to feel that they're cared for and they're actually known. They're not just a number or a Medicare card, for instance. We treat every patient like family, and that shows throughout the whole team. So that continuity across the whole team, reception, nursing, GPs, it's what builds genuine trust over time and breaks down barriers for patients entering care. And that genuinely means, it might be that we see a lot more patient visits than not, and that genuinely benefits patients. So for the Ringwood as a community, it matters enormously. People want to feel like their local GP clinic actually knows them, and we work hard every day to break down those barriers and be that place for them.
So Arris, as the manager of the clinic, and obviously the leader there, obviously you're meeting regularly with all of your practitioners so that they're really clear that you're on the same page, the same philosophy with regard to the care that's being offered. Is that what you do?
Yeah, it's a really great question and something that probably patients would never see. So we meet quarterly as an accredited practice to discuss improvements for the practice, obviously touch on our pillars that we have and the philosophy that we follow. And as part of that quarterly meeting, we also discuss patient care and how we can improve it and all of these aspects. But that we don't wait for the quarterly meetings. We're touching base with the GPs every single day to discuss ways that we can improve patient outcomes or deliver care for specific cases. It really kind of is an ongoing active role that we play throughout each day.
Leyton, if I can come to you now, osteopathy can play a really important role in helping people manage pain, mobility, and overall well-being. What are some of the common ways that you support patients at the centre, and how does that contribute to a healthier lifestyle for just, again, the general broader community?
Yeah, I think in terms of over ways that we're supporting patients beyond just the manual therapy side of things, a lot of what we're doing, because osteopathy is similar to general practice, primary healthcare, people can come to us without referrals. Some of what we do is triaging, but at a much more minor case by case basis. Someone might mention, we're having troubles with, something that's a little bit not musculoskeletal related. We might have the person in our contacts to refer on to, the same as the GPs would. And I think that making sure that we're coordinating with those other healthcare practitioners is really important for, as you said, healthier lifestyles is such an important part of public health. Yeah, health of the community.
So Leyton, I would imagine there are times when you're perhaps treating a patient, then you may need to confer with another practitioner there. Does that happen fairly regularly, as I think you're suggesting?
Yeah, well, and as Arris was saying, we occasionally come to the GP's quarterly meetings as well, but we're not waiting for it. We're catching them in the hallway, in the lunchroom, especially Dr. Maindit, catching them in the hallway all the time. And even the other allied health people in here, yeah, we're catching them for a chat. Might be asking on better ways to manage our own patients, or how might we pass them on to them? How might that be appropriate? Yeah, I think that's really important.
Yeah, and before I go back to Arris, I'm just thinking, is there, like, without having to reveal all the details, has there been a time when you've chatted with another practitioner in the corridor and there's been quite a revelation about the way, maybe a change in direction as to the way that you're going to treat that particular patient because of extra information you received?
Yeah, I think that it is quite a two-way street in that way sometimes. It's I might come, we have plenty of shared patients in the practice, and I might catch one of the GPs about a specific patient that's just on my mind for the day, and I might have a specific pathway that I want to take for their care that the GP might not have had the time to consider just because of the nature of general practice. It's great to be able to, as you said, revelation. It does happen, absolutely.
Yeah. Arris, coming back to you, one of the stout features, I think, of your centre is just this partnership between, say, the GPs and the allied health professionals, as we've been just unpacking now, just working together under one roof. And how, with that particular model, how do you just generally feel it just really improves the health outcomes and accessibility too for local families?
Yeah, it makes a massive difference. So a multidisciplinary model simply improves health outcomes. It's as simple as that. So having a GP and allied health professional under one roof will fundamentally change what's possible for patient care. So instead of a GP referring someone and hoping that patient follows through with our allied health service, the coordination happens in real time within the same team, within the same practice. So for families specifically, we see a lot of young families. This is huge. So a parent might bring their child in for one thing, and we're already able to connect them to the right support without them needing to navigate a whole new system somewhere else or a whole new clinic. And it also improves compliance as well. So like when care is convenient and coordinated, patients are far more likely to actually follow through on the treatment plan assigned by the GP. And then from the GP's perspective, as mentioned, as Leyton mentioned, having allied health colleagues to consult with and refer to directly usually means that it's better clinical decision making. They go from working in isolation to working as part of a team. So accessibility is a real issue, especially in the outer east Melbourne. Not everyone can travel to multiple locations for different types of care. So being a one-stop shop, for instance, isn't just a convenience. For some patients, it is the difference between whether care is actually being accessed or not.
And as you've both been chatting, you've just brought to my mind too, and I know this wasn't organised to talk about, but about the healthcare plan, which is a great example when you can come in and talk to a GP, and then they can then, as you're talking about your plan and what your condition is and what you want to have treated, then you can think, well, I perhaps need one therapist for this and another therapist for that. So over your 5 bulk bill visits that you get, you might break that up between 1 or 2. Tell us about the benefits of that, because some people may not know about this particular plan.
Yeah. So I mean, Leyton, I might touch on it just in terms of the structure and the funding and all that sort of stuff, and then I think maybe Leyton can speak from a clinical perspective. But a chronic condition management plan is a plan that your GP will be able to provide to you if you have a chronic condition that is at least 6 months old or is perceived to last for at least 6 months. So, a very common one is pain. So chronic back pain or chronic pain anywhere in the body. And their GP can then assign this chronic condition management plan so that you can have Medicare rebated sessions with allied health services like osteopaths. And the plan basically outlines the chronic condition, and then we set a treatment plan on how it's going to be improved based on the allied health services that are being engaged. This has massive benefit financially. Obviously, there's the Medicare rebate for patients. If you don't have, for instance, private health insurance, at least you have 5 sessions per year that you can get back with Medicare. And then obviously it's the coordinated care. So working with your GP and working with the allied health to have positive patient outcomes and improve your quality of life.
And it's wonderful, and I know many people who are recipients of that, and it's certainly a huge benefit to be able to confer with the GP, but then also with the particular person that you are receiving treatment from. Leyton, I'll come back to you. And maybe, maybe I don't fully understand all the way that people are feeling, but many people may not realize how connected physical health is to overall well-being, including mental health and quality of life. How does working with a collaborative kind of healthcare team help you provide a more holistic care for patients, which we've really been touching on?
A two-pronged question there. I think it's better if I break it up a little bit.
Sure.
Absolutely. Physical health is a major factor in mental health, and vice versa, of course. It's something that we've got to be aware of, even as musculoskeletal healthcare professionals. I think something that patients often get stuck on a little bit is this notion of, especially in terms of chronic pain, as we were touching on a moment ago, that the pain is, in my head or whatever. Well, I say, of course it is. That's where you process it. Your brain's in your head. Of course, the pain is there, but that doesn't mean that we're making it up. Just sometimes having a shitty day is enough to make presentations worse. So being able to sort of unlock positive trends in physical health is really, really strong for being able to improve mental health outcomes as well. And of course, always vice versa. As for the other part of your question, we have a pretty close relationship with clinical psychology in the practice, and I've had good success with referring patients that I felt needed that little bit of extra care. And it's never coming at it in a way where we're accusing them of needing help in any way. It's always, have you considered, this sort of this sort of therapy to complement what we're doing here, or do you feel like you need the extra help? Or even if it's down to simple, lifestyle things, neurodivergencies, that sort of thing. Again, a huge link between mental health and physical health. One example being there's an interesting connection between hypermobility conditions and being neurodivergent, like having autism or ADHD. You're more likely to have a hypermobility disorder. So there's lots of reasons where we might be looking out for reasons to pass on patients in a collaborative healthcare setting for a little bit of extra care. And it usually is extra care. So we don't want to palm anyone off on anyone else. It's always, as you said, collaborative care.
Well, Leyton and Arris, I can speak firsthand about the high quality of care that you guys provide. I've seen it for myself, for my wife, and many other folk. And to just unpack the way that your centre works here today, I feel it's a great privilege, the country we live in, to be able to receive such high quality healthcare, and your centre is providing that right from when you walk in the door. So the welcome you get from you, Arris, and I know that you're very aware that they're making patients, folk feel at ease, so right through to the likes of Leyton and other folk that are working within the centre, providing really excellent care. So to come on the program this morning, I'm very, very grateful. Thank you for sharing at a deeper level about your centre, and thank you for being our guest at Monday Matters today.
Thank you.
Pleasure. Thank you.